Well, it's a massive pleasure to talk to the SDAP scheme. It's one of my favourite funding committee obligations that I commit to. You always get some great ideas. You always get a real sense of a community between the analysts, the researchers, the funding panel, and the policy customers, which is always great. So I'd say that you're second only to Canada in terms of that. So that's your benchmark. That's where you've got to get to. But it's a great scheme, so I'm really pleased to try and support it as one of the panel members. Cards on the table. I'm not going to pretend that I'm some sort of pointy-headed, massive secondary analyst. That's not. I've done lots of secondary analysis, and I've been part of projects and funded lots of secondary analysis and undertaken lots as well. But I'm in no way the kind of techno geek meta-analyst that some of the panel members are. So I'm coming at this from a very today's session from a very non-technical perspective, and I'm coming at this very much from a kind of, well, what am I looking for when I'm thinking about knowledge translation in the secondary analysis scheme? Because as the panel will tell you, the Secretariat will tell you, I moan every year about the same things because I've seen elements of when it works really, really well in Holland and in Canada, and I think we can do more to make it better. And by we, I mean you. So I'm happy to take questions at the end, and I hope we'll have enough time. But my aim is just to demystify some of the vagaries of knowledge translation. So what are we talking about when we talk about knowledge translation? So I struggled with trying to find an example of where the products of research and development, years of research development, when designed and read in one context, means something completely different in another context. And I actually came across this. It's a strange story. So my sister actually lives in Amsterdam. She's got four kids actually. I'm talking about 4 kids. And years ago, I got sent out to the local supermarket to go and find some infant formula for what is now our oldest. And I came across this slightly concerning kind of missive as I entered the supermarket looking for infant formula for her. And it struck me that this is a great example. So I took a snap of this and decided this was the best example. At face value, a bit alarming, but what I actually learned later on was actually what it means is, Mama, this, and it's, on many levels it's wrong, but mainly it's wrong because it's exhorting me to buy infant formula, but still. So I thought this was a good example of what we're talking about when we think about knowledge translation, that one of the big dangers of secondary analysis is that we spend a lot of time thinking about actually, do we spend a lot of time thinking about the questions? We spend a lot of time thinking about the analysis, and we spend a lot of time thinking about the data, and we spend a lot of time thinking about the academic presentation of that analysis of that data. But what we tend not to do is think about, well, what happens when the products of your beautiful minds enter the less beautiful minds of policymakers, decision makers, government, NGOs, commissioners, and so on. And I think it's a real risk. I think it's Gillian who said, I've actually sat on a few sort of service provision funding boards as a board member and a director, and I'm always stunned by the power of policymakers to misinterpret, sort of misuse, misrepresent analysis and research findings, and it takes on a very different meaning as a decision maker. And I'm really keen as a scientist and as a keen disseminator and someone keen to influence policy, that the kind of fidelity between my vision for the kind of science that I'm involved with and how I intended it to be used, there's as much fidelity there as possible. At the same time, acknowledging that once it's gone, and you don't have much control, but you can do some things to kind of minimise the dangers involved in misinterpretation. So my aim for the next sort of half hour is really simple. I want to do 3 things really. First of all, I want to just outline what I think knowledge translation is, and what it looks like and what it might mean for you. I think that's really important because, as we'll see, there are lots of approaches to this, and it's a buzzword. I mean, a bit like chastising Gillian for learnings. I can't stand the word learnings. Learnings and going forward is are 2 of my actual bête noire. I can't. It's a loathsome expression, but I'm also aware that knowledge translation for many scientists is a bit of a buzzword and a bit of a bolt-on, and I think it's important that we don't see it like that. So second, I want to briefly touch on why you should care about knowledge translation, because I think that's it is something you should care about for general reasons and very specific reasons for the SDAP scheme. And finally, I just want to spend the last part of the session thinking about how you might use KT in your application, but for obvious reasons, as we'll see, I'm spending less time on that than some of the other things. So the well-known social scientist and brilliant knowledge disseminator Bill Withers, who, as well as being a soul singer, was actually a fantastic secondary analyst, which I'm making up actually. Bill, I don't think Bill did any secondary analysis, but he was a master of taking sentiment and years of experience and expressing it in a way which encouraged people to do what it said on the tin. So, and I think what I want to flag up, nothing to do with Bill Withers, but this idea of use and using knowledge. So if you think about it, the reason for the SDAP scheme is for you to generate the most sort of robust, elegant, well thought out, well constructed, reliable analyses using the best data that you can get your hands on, and you know, developing that data as best you can so that it's as fit for purpose as it can possibly be. And I think there's no escaping that the results will be used, but it can be used in various ways, and it's often not really thought about by if it is thought about by scientists, it doesn't often show up in their applications in a way which reflects the thinking that's gone in. So Carol Weiss, so she was a brilliant sort of information scientist, sort of evidence-based proponent, and Carol, so as a social scientist, kind of came across this idea that the way that we use the results of knowledge are really in a couple of ways. So first of all, at one end of a continuum is a kind of intellectual, what we call a symbolic and a conceptual use for knowledge. So this is, if you like, your analysis providing a kind of enlightenment function for policymakers, helping to shape their ideas, increasing their awareness and their understanding through flagging key relationships, truths, directions that are present in your analysis. But at the other end of the continuum, and it is a continuum, there are instrumental uses. And by instrumental uses, we mean sort of directly shifting attitudes and perceptions, shaping behaviours, changing policy and practice based on research knowledge. And it's that instrumental use which the SDAP scheme is keen to see fostered, both in general terms, and we'll see later in some specific terms as well. And it's that instrumental use that I want to focus on today. But it would be remiss of me if I didn't also flag up the less intellectual and the less behavioural uses of policymakers. I think it's really important that we recognise that research fulfills legitimising purposes and beyond that, substantiating purposes. So by legitimising, what I mean is, any of you who've been around policymakers for any length of time, and if any of you fulfilled or engaged as researchers or scientists with feeding the policy beast, will know that there's a legitimising function for products of analysis where decisions have already been made, or the policy options are considered with other various kinds of knowledge. Experiential knowledge, political knowledge, and awareness, and values and propositions. The role of the research from the policymaker's perspective is simply to legitimise a choice that's already been made, which is absolutely anathema to most open-minded, scientists. And I think legitimising, there's no getting away from it. Some of your research, some of your analysis will be used to legitimise policy discussions. And why that's important for the SDAP scheme is you've all got policy partners for the SDAP scheme, people you've partnered up or buddied up with to support and sponsor and if you like, prosecute your planned study. It's really important that you have those sorts of discussions. We'll come back to the relational aspects of working with policy partners a bit later, but that legitimising function is a thing. It doesn't go away, simply because you've formed a relationship with a policy partner doesn't make it any less likely. So legitimising is the other element of it, and I think substantiating substantiating as well, which is, you know, a sort of similar element, is something that already happens as well with research. So adding credibility, legitimizing work, and just by virtue of the fact that you're part of a partnership, there's no getting away about you know, your input, your analysis legitimizes some of the choices, and your role and your analysis can help substantiate the choices that have already been made. And most of us, I think, would feel that that's not something we're particularly, well, I'm certainly not comfortable. I do science to try and inform options and try and inform choices based on truths, and I think feeding decisions that have already been made is not part of my role as a scientist. So there's a role for knowledge translation in combating some of that. So where does that leave us? So let me give you a working definition of what knowledge translation means. So knowledge translation, that it comes in many guises, and there's at least a 45-50 year history, at least, of it in its various guises. So I mean, back in the day, way back in the day, in the sort of 70s and 80s, the idea of diffusion of innovation. Then we had research implementation and research use. Then we had you know, evidence-based everything. Then we had knowledge transfer, and the more latterly knowledge translation, and there's a whole raft of terms that ostensibly all equate to a similar thing, which is the kind of the synthesis, the exchange, the application of knowledge by relevant stakeholders to accelerate the benefits of innovation, both globally and locally, and to strengthen health systems and improve people's health. So you can see there that the emphasis on instrumental use, influencing behaviours, strengthening systems, and the values, the attitudes, the behaviours that bolster and sustain those systems is very much around what knowledge translation is about. So this comes from this is a kind of working definition by the Canadian Institute of Health Research, who more than any other health system, I think, typify a relatively closed gap between a research community of analysts and a policy community of users who can coalesce around a series of approaches and models that they've found useful and have built on and refined over the years. And you know, if you talk to any senior Canadian sort of research chair, you know, they wouldn't be strangers to this definition. There are other definitions. Other definitions are available in the best in the context of broadcasters and so on, but they all say similar sorts of things. So just as there are many definitions of knowledge translation, there are many what are often sold as silver bullets for knowledge translation. So Andy Oxman, one of the architects of clinical epidemiology, knowledge translation, implementation, research utilization. So Andy Oxman coined the, you know, in his massive review in the late 90s, early noughties of efforts to increase research implementation, said, look, there are no magic bullets. There really are no magic bullets. However, this field is replete with magic bullets. So Anne McKibben has identified at least 90 of these magic bullets. These are kind of frameworks, models which purport to solve the problem of knowledge translation. And as we'll see in a second, that they're not all created equal. So I guess the challenge for you as secondary analysts is to think about the underlying framework and model, and we'll talk about why having a framework is important in a second. So this is a model from Ian Graham. So again, no apologies to Canadians because they do it well, and I wanted to flag this one. So this is a model that's got some traction. Some of you will have come across it. It's the knowledge to action cycle. It's or more specifically 2 cycles. And what Graham and colleagues have done since for 20 years now is recognise that for scientific analysis to be useful, it has to play into the kind of policy creation machine. So Sharon Strauss has looked at the myriad of definitions of knowledge translation and recognises that the best ones are the ones which mirror the kind of real world context that they're designed to address. So Graham and colleagues, what we've done is recognise there are two cyclical elements to knowledge transfer. The first is the kind of knowledge creation cycle. So this is where we're at with the SDAP scheme right now in the earliest stages, thinking about, you know, your questions, thinking about your approach to synthesis and analysis, thinking about the kinds of products and tools and the kinds of tailoring that's required, and thinking about at this stage the quality and reliability and your ability to design analyses and work with data that combat the well-known elephant traps and barriers to good quality analysis. So giving the messages and the tailoring the highest possible chance of success at this stage. But alongside that, parallel to it, and so happening at the same time, there's an action cycle, and that action cycle will be playing out right now, or should be playing out. We'll talk about it in a bit, but should be playing out in your applications. So, you know, there's a policy cycle which happens, you know, for the best knowledge translations projects, happens alongside some of that creation of knowledge, which is around problem identification and, you know, and adaptation to local context, how it's going to be used, thinking about the interventions and the evidence base for those, and how you might tailor and implement and feed planned interventions linked to your analysis and so on. And so I guess at this stage, I just wanted to flag up that this is one of a myriad of approaches. There are no right or wrong approaches, but there are questions you can ask of yourself as analysts that can give us as funding panel members more confidence that you've thought about the approach that you're going to use. And you will have come across some of these approaches. I mean, diffusion of innovation is a classic, the Everett Rogers stuff. It's simple, it's got a long history, well operationalized, but there's the Greenhalgh work on inner and outer context and the results of her initial NHS review, R&D review, and then more latterly the NAS framework. You've got Paris and the Promoting Action on Research Implementation, and Joe Rycroft Malone and Alison Kitson. There's normalization. There's a whole raft of them. Paris, loads of 90 of them. So none of them are perfect. None of them are a silver bullet, and they all have pros and cons. But some have some key facets that I think we should think about in a second. So, as I said, there are no perfect frameworks, there are no perfect models, and they all share certain things. And I guess the reason I'm flagging this, putting this slide up for you, is that I wanted to draw your attention to the kind of key elements of these models, and really just as prompts for you to go away and think about, okay, so how can I pay homage to these prompts in my applications? So all of them recognise that there are a variety of steps from creating new knowledge to application. So from the initial questions and background of the knowledge gaps that you identify, right through to the approach to analysis, through to a planned dialogue and planning for dialogue, and thinking about ways in which your knowledge should be applied and could be applied, and how to narrow the gap between should and could, and trying to keep fidelity, if fidelity is important to you. Communication is two-way, so you should all have policy partners for your SDAP applications. Those policy partners should be engaged, but it shouldn't be a one-way street. So it shouldn't just be you sucking up policy need and not taking your existing knowledge and trying to shape the articulation of that need. It works both ways. And so, you know, thinking about that and how you might communicate that multi-directional, you know, conversation, the quality of your communication, your application is important. It should be, knowledge translation is interactive, which is anathema to people who do secondary analysis, because many people, you know, do secondary analysis because they don't like people. So, you know, being interactive is really important. So, you know, this is a process that relies on contact between parties, and it's ongoing. So soft elements of a relationship like trust and the role of feed forward and feedback are important, because you're going to be working with these people for a minimum of a year, 18 months, 2 years, 3 years. That ongoing collaboration needs feeding. It's not something that will look after itself, and your analysis as it emerges is part of the ingredients of that relationship. And so giving some thought to how you're going to sustain that collaboration is important. there's no one single, so simply having a kind of fortnightly meeting and hoping that will be enough to sustain and grow this collaboration and close the gap between should and could for your knowledge is unlikely to happen. So, you know, I'll give examples in a bit about activities that we've done in projects to show that, you know, it needs to be multiple activities. You know, a conversation by Zoom once a month probably won't suffice. It needs to be more than that. I mentioned feed forward and feedback and the fact that most of you will be generating analyses and results which have to be taken up by really complex systems. And by complex systems, I mean, you know, systems which rely on lots of interconnected components. So, for example, you know, those of you who are working around drug policy, you know, you've got at one level you've got you know, political decisions based on, you know, based around normative ideas of what drug policy should do by politicians, having to be balanced against descriptive realities of how people feel about drugs and drug policy and drug users and what's electable. You've got an executive trying to, you know, adhere to high quality policy and with dimensions like equity and fairness and so on. And at the bottom level, the people who are putting into practice, you've got a whole load of street level bureaucrats, what Lipsky calls street level bureaucrats, who will be interpreting your findings, interpreting the policies that fall out, and have to enact that with individuals and groups. So, you know, the net effect of all of that complexity is that your results will change, and the application of those results, it's unlikely that the more results you generate and the higher quality of the knowledge, the more application will happen and the better quality of the application will happen. So recognizing that non-linearity, I know it's a bit of a buzzword, but it's an important dimension of thinking about how you present your results. In a nutshell, simple is often better, knowing that it'll be a complex environment and it's a complex set of users' needs that you'll be playing to. You're recognizing that it's a hard pill to swallow, but the truth is that research knowledge is just one of a multitude of knowledges that people have to use to make policy. And often, and I speak as somebody who's had to do policy, often it's the least important form of knowledge that we use as policymakers. It's you know, the other things do and often do and should probably trump research generated knowledge, particularly when that research generated knowledge has uncertainty associated with it, which of course you and I know is all research knowledge. But the phrase uncertainty to a policymaker is not something that we live comfortably with, and so you know, it's an unusual sort of marriage that needs work, but it's a truth. We've talked about complexity, but actually that complexity spreads to the diversity of who uses your knowledge. You know, you'll have people there. So if you take, for example, a health services commissioning sort of body, you'll have clinical scientists in areas like public health, epidemiology, who'll be well used to interpreting you know, population level effect sizes and applying it to groups and subunits in a population. But alongside that, you'll have hardcore you know, managerial types who are experts in human behaviour change, or think they are, and services and planning and economic forecasting and so on, who may not be as familiar or maybe overconfident with your kinds of results. And so thinking about that diversity and who's going to be engaging with your analysis and how is an important dimension of any argument that you put forward for how you're going to increase the knowledge translation function of your work. There's a specificity to the uses and the context. You know, changing clinical practice guidelines in 20 hospitals in Ireland is not the same as influencing drug policy across the nation. You know, there's a specificity there which needs to be replicated in the planning. But for us, well, for me, as a funding panel member, I'm interested in impact orientation. I think your analysis shaping ideas and fulfilling intellectual purposes is interesting. But ultimately, I want to see that you've given some thought to how you'll change dry research analyses into, give it the best chance of changing it into the kind of messy for behavioural aspects of for things you'll need to make your contribution real for decision makers that are using it. And more crucially, it's interdisciplinary. We very often see economists playing to an economic audience, and we see psychologists playing to a psychology audience, and we see issues of psychology focusing on behaviour change, we see economists focusing on incentives and disincentives, and we see health services researchers talking about complexity in systems and so on. So bringing together different disciplines is really important for a good application. There are no magic bullets, but there are useful frameworks. But before you go rushing off to select a framework, it's really important that you acknowledge that there are some sort of problems with all frameworks. So let me try and simplify some of this. One of the big elephant traps, and the thing that I loathe most, is the end of grant approach to knowledge transfer. So broadly speaking, there are two approaches to knowledge transfer. So take a framework like knowledge to action, the Ian Graham one, and think about what I said around it's two cycles, next to each other in parallel. And yet very often what we see is an end of grant approach to knowledge translation, which is do analysis, it's rigorous, it's sexy, it's scientific, it's elegant, and at the end of it you've got what you can almost guarantee you can write it, which is peer-reviewed articles for academics, professional articles for clinicians and policymakers. There'll be some PPIE groups, possibly sense checking. God help us, there may even be toolkits, always toolkits. We can never run short of toolkits. And all of that will happen in a kind of 2 or 3 month window at the end of the project. And that's great, and it's fantastic, and it's run of the mill. We'll have a pile of 20 applications or 30 applications for the scheme. If they're all doing that, it's really hard to delineate and demarcate between their approach to knowledge translation. Far better is the kind of integrated approach to knowledge translation, and less common, which is telling us how you're going to shape your questions, telling us how you sense check your analyses, telling us how you're thinking about conversations with your policy partners to shape how you're going to present the results and where in the system they're injected and so on. So integrated approaches are less common, they're more challenging and they're more difficult, but the value added can be significant because it will set your projects aside from others. So there are some big issues with knowledge translation, and what I'm looking for is that you recognise some of these. So first of all, I'm interested that you recognise that, for example, changing clinical practice versus changing drug policy at national level are not the same, and that you've thought about which model you're going to use and why. But the concepts and the frameworks and the theories are common to all models, but not all models are created equal. So the predictive validity. So all models, all theories should describe and crucially predict. And then, some models do better than others. There are small anecdotal approaches to knowledge translation, which now boil down to, I forged a relationship with a policymaker. They got to like me. I asked them what they thought about my science, and they said it was great. Therefore, this model's fantastic. Versus something like Everett's diffusion of innovation theory, with something like 15,000 applications synthesized, summarized, the properties of the different elements described and summarized, telling you how likely you are to influence various bits of the machine and the decision makers and so on. Or even at a more middle range theory level, normalization process theory. I think there are now 200 plus applications of normalization process theory in which they've described and registered in advance the effect sizes they expect to see and how that played out, the various elements of the core concepts associated with that model, and how where the gaps are and where future applications, your applications, future research could best plug those gaps through well-designed testing and validation in your context for your problem. So I'm looking to see that you've kind of thought about those gaps and how you're your SDAP application might add value to what we know, or more accurately, what we don't know about knowledge translation in your context for your data with your policymaking problems. Yeah, and what I'm most looking for really is that you're at the end of your project, you've played a part in refining and adding value to existing, for me, mid-level theory, because I'm interested in the very specific context and the behaviours associated with your policy problems and your policymakers. And for me, mid-level theory is the kind of the normalization process theory, the NAS frameworks, that level of theory, as opposed to the grand level theories of expected utility theory and big economic thought and so on. I'm less interested in that because it's more abstract, and I think the SDAP level plays to a more specific scheme. So why are we why have I got a picture of a lovely Irish baby up there? Well, Mary Dixon Woods coined the phrase lovely baby syndrome, which is where something seems like such a good idea, but it's the basis for it is irrefutable. And I guess from a knowledge translation perspective, what we're interested in is your ability for an application to combat that lovely baby syndrome, where, you know, just because a policymaker says this is a no-brainer, we need evidence to sustain it and to legitimize it. We're interested in a more challenging perspective, which is there's a knowledge gap, and we've worked with a policymaker to understand how we might plug that gap in ways which ask the difficult questions of the data that we've got available. And the reason we do that is partly because we're not the same. You and I, and you and policymakers, like me and policymakers, are not the same. We, to put it bluntly, policymakers really don't care, or practitioners really don't care about theory unless it's useful for them in their context and it's relevant for them in the here and now. We, as scientists, absolutely care about theory because we're paid to care about theory, to test it, to validate it, to grow it. We get rewarded for that. So we're two different tribes, and the knowledge translation model is the way we bring those two tribes together. And in the same way that I've emphasised, I hope, that it's formal behaviour change and instrumental adoption, and that I'm interested in use. I'm interested in formal theory, formal models, and how your application relates to that and how you've built it in. There's more. I've put references throughout all of these slides, and I've emailed Gillian the slides, but there's more on those. I just wanted to flag this up to show you that it can be done. So this is from Robbie Foy and colleagues. So Robbie did the MP-FIT trial. He looked at the National Diabetes Audit. He looked at the National Trauma Audit, big secondary data sets from lots of trusts in the UK. And what Robbie did was he specified a program theory which kind of outlined and operationalized the key variables, but crucially the direction of those operationalized variables in his data set to a group of mechanisms which are around, in this case, innovation diffusion theory and Rogers, and then adapted feedback to policymakers and to clinicians, and then looked to see how the data changed as a result of that feedback in a very structured and systematic way by manipulating the mechanisms that were available, manipulating the inputs to the model in a very systematic way. If you want to read more about this approach at a level of knowledge translation, I'd encourage you to pick up Jeremy Grimshaw, Noah Ivor's work, was a reference in one of the citations around the role of audit and feedback. Less on audit and feedback and more about the role of theory and systematizing it in secondary analysis and doing it well. I've put links. I don't know if we've got time, but basically I'm just going to talk about the dead salmon phenomenon. So those of you who've ever come across the Ig Nobles are a brilliant source for all lectures, but the Ig Nobles, so this is the dead salmon phenomenon whereby big data and huge amounts of data create very particular challenges, and if you're not mindful of data quality, it has implications for knowledge translation. So the dead salmon phenomenon was, I think it was Better and colleagues who were, I don't know if any of you know about functional MRI, but the way that we used to calibrate functional MRI was balloons with mineral oil in and changing the degrees of contrast and structure, and they wanted to do something a bit bit more robust, and so they started with a chicken. So an MRI of chickens and doing repeated experiments. Each experiment generating 130,000 data points, so big data. And then they moved on from a chicken. We decided a chicken wasn't really good enough, so we decided that a salmon would be the way to go, a dead salmon. It's a bit Monty Python, but basically what emerged was a combination of multiple comparisons and not adjusting for multiple comparisons. The upshot of it is that when they didn't adjust for multiple comparisons, this data set basically indicated that the spinal cord and the brains of these dead salmon were false positives, meant they were kind of classified as active things, and basically these dead salmon were suddenly brought to life through the power of statistical analysis. And you might think, well, that's such a stupid example, sort of reductio absurdum. However, about 45% of all of the existing extant functional MRI evaluations, all right, not with dead salmon. However, they fell prey to the same statistical trap of not adjusting for multiple comparisons. And there are others. I mean, you'll be familiar. You should be in this scheme. You'll be familiar with p-hacking, with not specifying your hypotheses in advance, the being familiar with your data before you analyze it and not being blinded to it, not registering your hypotheses and your design. Choosing frequentist approaches because you can do them rather than Bayesian methods because it might be new to you, and taking really simple approaches to causal relationships. So all of these things are well known, even to me as a non-statistician, they're well known, and they all protect against bias. But bias in the knowledge translation context is not an abstract thing. It's a very real thing because it affects the messages that you're feeding into the policy machine and the frameworks that you're using. So my point of this slide is all of those hyperlinks in the slides. Have a look at the stuff and have a real think about how your designs, your analysis, your planned analysis can strengthen the power of the messages that are going to be translated in the frameworks that you adopt. You know this. I don't want to talk about it. Basically, the specifics of why you should care about knowledge translation. I've already said it in a way. The scheme requires you to. And I know the scheme has set benchmarks. You need a policy customer, you need a relationship, they need to tell you what they've done in the past and they need to commit to helping you in the future. That's not enough. Tell us about how and why that's going to work for you in your project, which is really important given your knowledge translation framework. And the good news is, given the time frame, I'm not actually going to tell you how to do it because I'm not going to reinvent the wheel. In doing so, a bit of research for this, I found there's a fantastic set of resources for planning knowledge translation in an Irish context, which is really draws on really high quality resources and gives great Irish context resources. So I'm absolutely not going to tell you how to do it. And also the reason I'm not going to tell you how to do it is because this is a competition. So the aim is for you to, hopefully be inspired by some of what I've said and to go away and to look at these high quality resources and build them into applications, so that actually the key task is for you to delineate your application from your competitors, so that it makes my life easier as a funding panel member, being able to use a knowledge translation box and the thread that runs through your application to go, fantastic application, work to do here, let's give them some feedback and get them back next time.